Hello everyone, welcome to Patient Knowledge. I'm Dr. Kirmani and today I'm going to be talking about a skin condition that's common in children called impetigo or school sores. So let's get started. What is impetigo? Impetigo is the bacterial infection of the skin that is caused by two types of organisms, Staphylococcus aureus or Streptococcus pyogenes, and it's also called as school sores. The skin lesions mostly appear around the nose and mouth. Now, who gets this infection? Children have vulnerable skin and are exposed to bacteria at playgrounds and schools. Skin conditions are common among them, and impetigo is one of them. Now, it's seen in children with poor hygiene. Those who have poor nutrition are prone to get this infection. Newborn babies are at high risk because of weak immunity. And children living in warm, humid weather and those who live in crowded conditions can also get this infection. How are the skin lesions? They appear as small patches of blisters around the mouth and nose, which break open and ooze out the fluid. The weeping areas of red skin develop. Honeycomb crusts are formed on the top. These lesions are not painful at all, but they are quite itchy, and they spread rapidly. Impetigo can also occur in other areas such as arms, legs, and buttocks. Now this is a picture which shows the typical lesions such as blisters present around the mouth and nose. I would also like to mention that it should not be confused with another infection called cold sores, and that one is caused by a virus called herpes simplex virus. So if you're not sure, see your doctor. Now you must be wondering, is it contagious? Yes, it is highly contagious. It spreads through direct contact or by sharing toys, beddings, towels, and other personal belongings. Now, how is it diagnosed? So if your child gets lesions and you're not sure about it, see your doctor. Your doctor will evaluate by asking important questions regarding the general health of your child and will also perform clinical assessment. And a child who is otherwise well, does not have any flu-like symptoms such as fever or tiredness, the diagnosis is obvious, with the typical honeycomb-crusted lesions, which can be confirmed by a skin swab and culture. Now, complications. There are a few complications of this infection, such as severe kidney disease called as post-streptococcal glomerulonephritis. It can spread to other parts of the body. Rheumatic fever is also one of the complications that affects the joints, skin, brain, and heart. And other skin-related problems such as eczema, dermatitis, or fungal infections can affect the child. Treatment. Now it's a bacterial infection and antibiotics are used to treat the infection. They should take the full course of the antibiotics even if you see that your child is getting better and the skin problems are improving. Do not stop the treatment and continue the full course of the treatment. This is important because it has some serious complications and the infection must be treated completely. Now, other alternative is antibiotic ointment, which can be used as to apply on the skin. Antiseptic lotion such as povidone iodine is also useful. Prevention. It's a highly contagious infection, so isolate the child from school, preschool, and their own siblings. Their fingernails should be cut short because they are likely to scratch a lot and this will worsen the infection. Never share the patient's personal belongings such as towel and soap. Keep their bedding, clothes, and towels separately. If it's necessary, cover the sores with waterproof dressing, and all the family members should wash their hands with antibacterial soap to prevent the spread of infection within the family. That comes to the end of this video. I hope it was helpful in understanding impetigo. Thanks for listening. If you like this video, like and subscribe to my channel. Every week I'll come with videos that are related to health conditions. You can also let me know if you wish to hear about any conditions. Just leave it in the comment box below. Bye for now.